They sent us to go fight unconventional wars. They need to stop being so conventional in the way that they deal with us.
You're like, oh, Patrick, your 15 minutes are up.
They told him that, oh, PTSD is just something you have and get paid for. We can't help you.
Either you can have these pills or these pills.
The military hardens us up. And this is a thorough treatment that unravels us from that hardening that they gave us.
My name is Jenny Plim. I'm a licensed massage therapist and a CranioSacral Therapist, and I've been doing the work for about 7 years. Instead of starting with the head and asking people like what's going on and having people try to figure it out, it's a way of listening to the body. And like the body tells you everything that you need to know. It's very smart. So by, feeling what's going on in the body and bringing the person's attention to it and having conversations about that, it just opens up what's happening and what could be released and what's possible in a different way for people. So today we had 5 veterans. Some were dealing with issues of depression, some were dealing with startle responses, and then there's just physical pain.
Can't really relax much at all. Then I had a hard time even on the table for the first, and I don't even know at what point. I just remember like still feeling like tense and uptight, and then going to like the euphoric just, I don't know, feeling like just stuff like draining or pouring out of it. It was weird, but like and then by the end of it I was relaxed, I was breathing, I was like just genuinely happy.
Mimi worked with Rachel. The motion of the dural tube was striking to her, so normally the occiput and sacrum move this way and then they move that way. Like when there's the system fills with the fluid and then empties with the fluid, there's this rock and glide kind of motion. And she said it felt like it was doing this sort of thing. It was just slamming up and down and back and forth. It's just interesting to be able to feel that motion in the body and know that that's off. That's not how the body's designed to move. And to settle it and then hear somebody say, wow, I feel more grounded and I feel more clear.
Apparently got some energy out, anger-wise. Like, I'm not a very angry person. I'm pretty mellow. I tend to just direct it, but there's not always a place to direct it.
You feel waves, you feel rushes. It's not a lot of movement.
It's really subtle.
It's emotionally calming and very tranquil. It's like a reboot.
I felt like when I walked out of here and I was going to ride my bike home, I was like, no way I'm going to ride my bike home. Because it was just a really intense feeling. Like I felt like everything was brand new around me. Like every experience was new. It was strange. I felt like a little kid.
After the treatment, I was getting a lot of head rushes. I felt like my brain was just yarning. Like it was seriously waking up. And I felt very light. And I was going to go straight home, but instead I was so happy. I went to the movies and saw a comedy instead.
Today I worked with Patrick. In the beginning, the temporal bones were kind of torquing and pulling down this way, and by the end of the session, they were going through their normal motions, expansion and contraction. You could sense there's still a little more work to be done, like releases in the temporal bone area and sphenoid, but compared to where he started, there's a big difference.
It's really helped me, make some progress and move forward in my life.
I have to be honest, I kind of thought that I would be the one person that this wouldn't work on, but that negativity went away, and I don't know, I feel like happy, energetic. That my shoulder and my neck have been like bothering me for the last like 6 months, and it's not, but like I don't know, it feels really good, and I feel like kind of high, like a good high. Like I want to go home and like make a cup of tea and actually do my homework ahead of time.
I know that what this work does is it integrates people again, and it can help put people back together.
It is very effective. It really is. I would want to continue.
Judging from this group here, it's going to be pretty universally effective.
I think it would be valuable for people to invest in it because it's real care. It's care. Like it's somebody one-on-one with you, like actually, caring, and not just being like, oh, go down down and wait for an hour, get this random pill.
I feel much better now than anything else, than from anyone else I've talked to, and then from like any pill that they could give me.
Yeah, I think that, you know, it could help a lot of people, you know.